Hello, Hamilton Southeastern staff. Welcome to the Question, Persuade, Refer training, also known as QPR, an evidence-based suicide prevention training. My name is Brooke Lawson, and I'm the Mental Health and School Counseling Coordinator for Hamilton Southeastern Schools. Throughout the next few modules, you will learn about some of the reasons this training is important for school employees, what some of the warning signs and risk factors might be for an individual who's considering suicide, and then how you might approach that person in order to get them the support they need. Joining me in this training are a few of my colleagues who are also QPR certified trainers. Chris Graves, school counselor at Riverside Junior High and suicide prevention coordinator for Hamilton Southeastern Schools, and Ryan Taylor, the director of staff and student services. We're first going to watch a quick video to give you a preview of what QPR is.
Research shows that the odds of surviving a heart attack in a public place are 10 times greater in regions where thousands of ordinary citizens are trained in CPR. It's called bystander rescue. When someone shows signs of experiencing cardiac arrest, the response of nearby friends, family, or coworkers is critical. The effective use of CPR doubles or triples one's chances of surviving a heart attack. Like CPR, QPR is an emergency intervention for someone experiencing a life-threatening crisis. QPR is easy to learn and easy to remember, but it takes courage to overcome our fears about reaching out to help someone who may be considering suicide. Research also shows that where QPR is widely taught, suicide attempts and deaths decrease. Just like CPR, QPR requires quick, bold, and informed action. Because suicide, like heart attacks, remains a rare event, we must train hundreds to save one, thousands to save hundreds, and millions to save thousands. There is an old Welsh saying, "No great misery goes unspoken." When we have a toothache, we tell people. We don't hide our pain. But because of the stigma and taboo around the word suicide, many people considering suicide don't speak plainly about their suffering. They fear our rejection. They fear that if they say something, we will ridicule them or make fun of them. As a result, people thinking about suicide often use indirect language. They hint at what they're thinking of doing. They send us coded messages, and they suffer in silence. Called suicide warning signs, QPR training teaches you how to recognize these warning signs, quickly decode them, and then question the person in an informed and compassionate manner to learn if they are considering suicide. Just as talking about physical pain helps diminish it, talking about suicide with someone willing and able to listen reduces psychological pain almost immediately. Trained QPR gatekeepers are merchants of hope, and hope helps prevent suicide. Millions of people have now been trained in QPR. Rigorous independent research studies support QPR as effective, and thousands of personal stories assure us that QPR is saving lives. When you use QPR, not everyone will be suicidal. Some people are simply stressed to the breaking point, but they still need help. Help you can give. Please note that you cannot put the idea of suicide into someone's mind. People are either thinking about suicide or they're not. The fear of putting the idea of suicide into someone's head is a myth that keeps us from acting when we should do just the opposite. QPR is a universal intervention for people in pain, whether they're thinking about suicide or not. While it takes a special courage to overcome our fears, we will teach you how to ask about suicide and to offer hope through listening. Listening is the power tool that restores hope in the hopeless. We know you can do this, and we will show you how. Preventing suicide. It's what people do.
You may be wondering why this training is important for school staff. We believe that educators are an important first line of support in suicide prevention. We don't expect you to provide an in-depth assessment or counseling of a student who's struggling, but we do believe it's important for you to know how to discuss and ask questions of students who you may be concerned about. By letting students know that they can come to you with concerns about themselves or their peers, you're opening the door for your students. Research shows that students are sometimes hesitant to tell an adult about concerns that they have about themselves or a peer because they're unsure of how that adult might respond. HSE Schools has been engaging school staff in QPR training since 2015. And since then, we've seen an increase in the number of students who feel comfortable talking to adults when there are concerns. And we've been able to connect those students to the support that they might need. As we continue to identify the importance of this training, I would like to share some national, state, and community data around youth suicide risk. Research has shown that suicide rates across the country have increased among youth over the past 10 years. In fact, it's the second leading cause of death among youth ages 15 to 19. Research has also shown that girls are more likely to attempt than boys, but oftentimes boys are more successful in completing suicide, as they tend to use more lethal means. A recent study by the EAB found that 3,069 students in grades 9 through 12 attempt suicide on average each day. In Indiana, these statistics are no different. Over 52,000 youth attempted suicide in 2016. 1 in 5 high school students reported having seriously considered suicide in the last year, and Indiana ranks second out of 34 states measured in the percentage of students who made a suicide plan, and third out of 37 states measured in the percentage of students who seriously considered attempting suicide. As a part of the Fishers Mental Health Initiative, the City of Fishers has begun to collect data around the number of behavioral or mental health incidents that our public safety team supports. The numbers above break these down. As of September of this year, our public safety team has responded to a total of 331 mental health calls, the majority of these being adults. Of those 331 calls, 114 of them resulted in an individual being taken to the hospital because they needed an additional evaluation and support. We call this an immediate detention. The city also keeps track of the number of community members who die by suicide. This year, we have seen some of the lowest numbers we've seen in quite a while. This graph shows the number of school suicide risk assessments provided by our school counselors and administrators in white, and the number of students who were then passed along to our school-based mental health providers in black. As you can see, this number is decreasing each school year. We attribute this to all of the great work our educators have done around suicide prevention, social-emotional learning, and the ability to refer struggling students to mental health providers located within our schools. While some of the statistics that I've shared might seem alarming, there is help and hope when parents, schools, and communities join forces to address suicide as a preventable public health problem. Before we get into the bulk of our QPR presentation, I wanted to review a few common terms with you. The term suicide is used when someone dies from an injury, including poisoning or suffocation, where there's evidence that that injury was self-inflicted and intended to cause death. A suicide attempt is a potentially self-injurious behavior with a non-fatal outcome, for which there's evidence that the person had the intent to harm themselves, but was rescued or changed their mind after taking initial action. Suicide ideation refers to self-reported thoughts of engaging in a suicide-related behavior. Suicide loss survivor refers to those who are left behind after a suicide. And suicide attempt survivor refers to those who attempted suicide and were not successful.